Staphylococcus is a gram-positive bacteria that form grape-like cluster. Staph means a bunch of grapes. It commonly colonize human skin and the mucous membrane, particularly the nose. It can cause a wide range of infection, from minor skin infection or minor skin issue to severe life-threatening systemic disease. Let us see disseminated staph infection. Staphylococcus aureus or Staph aureus is the most common and virulent species associated with disseminated infections. It can be medicine susceptible or medicine resistant or MRSA. Disseminated infection is defined as infection that originates from a localized site and spreads through the bloodstream to infect multiple and non-contagious organs. When we came to pathophysiology of dissemination, the first is breach of barriers. Entry into the bloodstream or bacteremia often occurs via break in the skin, surgical site, or a medical device. Some cases may arise without a clear portal of entry. The other is the Trojan horse mechanism. Staph aureus can be engulfed by host phagocytic cells, such as neutrophils, macrophages. And instead of being killed, the bacteria can survive intracellularly and be transported to distant organs by these immune cells. Staph aureus produce a variety of toxins and enzymes that damage host tissue and promote spread. Common examples include panthen, valentin leucocidin, exfoliative toxin, and others. Conditions like diabetes, immunosuppression such as chemotherapy, RVI infection, and chronic illness increase the risk of dissemination. Skin and soft tissue infection are a common starting point. Hospital-acquired and community-associated infection are prevalent worldwide. Hospitalized patients, especially those with indwelling medical device, catheters, and pacemakers, post-surgical patients, patients with chronic illness or compromised immunity, and injecting drug users are high-risk population. Spread occurs primarily through direct contact. They can be transmitted via contaminated objects such as fomites. Systemic symptoms include high fever and chills, fatigue, sign of sepsis and septic shock including hypotension and multi-organ failure. To see organ-specific complications, infective endocarditis is one of the cardiovascular complications. Infection of the heart valves leading to regurgitant murmurs, embolism, and heart failure. It can also cause pericarditis and pericardial effusion, inflammation and fluid accumulation around the heart. Respiratory involvement can cause pneumonia, severe pleuropulmonary disease with high fever, cough, and chest pain, and sometimes collection of the pleural space or empyema can happen. Clot containing bacteria might travel to the lung, causing septic pulmonary embolism. Musculoskeletal complications might be osteomyelitis, septic arthritis, or infection of bone and the joint, which can cause pain, swelling, and reduced function in the affected area. Neurologic complications can be encephalopathy or brain dysfunction, epidural abscess, or collection of pus in the space around the spinal cord or brain. Skin and the soft tissue complication can range from cellulitis and abscess to staph scalded skin syndrome, which causes widespread peeling skin, especially in children. Toxic shock syndrome caused by staphylococcal toxins, resulting in high fever, shock, rash, and multi-organ system involvement is skin and the soft tissue complication. History and the physical examination is very important to diagnose disseminated staph infection. A thorough history, including any recent skin injuries, surgery, or hospital stay, is critical. Physical signs such as fever, new heart murmurs, or swelling guide the diagnostic workup. Laboratory tests can be blood culture, which is essential for identifying bacteriemia and the specific Staph aureus strain, C-reactive protein, WBC count, which are inflammatory markers, are typically elevated. Culture from other sites, from past soft tissue or affected joint, might be cultured. echocardiography to evaluate for infective endocarditis, CT or MRI scan to identify deep-seated abscess, osteomyelitis, or other metastatic pockets can be done. When we came to treatment, the first is antibiotic therapy. Empiric therapy often involves broad-spectrum antibiotics like vancomycin, especially if MRSA is suspected. Once sensitivity results are available, treatment is narrowed to a more targeted antibiotics or directed therapy. In addition to antibiotic therapy, source control is important. Surgical drainage of abscess or infected collection is often necessary for successful treatment, and also removal of dead tissue or debridement. Infected indwelling medical device must be removed. Removal of those devices is important. Supportive care include management of complications like sepsis, organ failure, fluid imbalance. The duration of therapy, treatment course is prolonged 4 to 6 weeks or longer to ensure complete eradication of the infection. Prevention is mainly by infection control in healthcare setting. Hand hygiene is paramount for healthcare workers and visitors. Strict protocols for the care of indwelling medical device and patient and public hygiene such as washing hands with soap and water, keeping cuts and scripts clean and covered, avoid sharing personal items, do not share towels and other personal items, and also recognize and address carer status, screening high-risk patients for nasal carriage of aureus, and decolonizing with topical antibiotics such as mucosin may be considered. Disseminated staph infection has a poor prognosis, especially with delayed treatment. Mortality rates of Staph aureus bacteremia can be high, approximately 20 to 40%. Disseminated staph infection is a serious multisystemic illness that requires prompt diagnosis and aggressive treatment. The high mortality rate nested a low threshold for suspicion, especially in high-risk patients. Effective management hinges on a combination of appropriate antibiotic therapy, timely source control, and supportive care. Prevention through rigorous hygiene and infection control measures is the best defensive or preventive mechanisms. Thank you for watching.